So last time we started with Carla, and Carla was telling us about her son who had his wisdom teeth out. And we were doing our three-legged stool thing of saying, what are the crucial things that we need to find out about this? And we had come down to bryonia. And so that was a great choice. That was actually what was given. And some of you were able to tell right up front, oh, this has keynotes of bryonia, which is fabulous. It lets you recognize, but then you're like, oh, what do I not know? What is it that I am not aware of, that I'm not thinking of right now, that might be even more relevant? And if I just had a little nudge, I just had a little reminder, then I would say, oh, this could be ledum, this could be nitric acid, this could be whatever else it could be. So, does anybody have any questions from last time? We ready to launch back in? With good old Carla? Okay. So let's just pull this forward to where we were. Ding, 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 ding. So how many of you have had a circumstance where an acute thing came up and you've got a clear pattern, you've got a location, you've got a nature of the pain, you've got an etiology, you've got some kind of specific sensation or modality, you've got something where the vital force is saying, over here, a homeopath is listening to me, please look over here. And so you recognize the pattern, the thumbprint that's in front of you. You repertorize, you don't repertorize, you keynote, you look in a reference book, you do whatever you do, and you find something and you give it to that person. And they're better. They pop up like a daisy that got tranced on and is all better for a while. They're better that day. They're better that morning. They're better that night. And then the next day or the next night, they're starting to wilt again, and you repeat the remedy and it worked so well before that you think, yes, I'm on it. And you give the same remedy in the same potency and nothing happens. Is it just me? Am I the only one that had that experience? That was really icky. And so then I would think, oh, well, maybe I need a different potency. In this example, maybe we started with Bryonia 30C for Carla's son. And so he takes it. And remember, he had that bad pain where even if he moved his foot, his jaw would hurt. So we give him Bryonia and he's better. Let's say that we have a 30C and that works that day. But then the next morning he wakes up, it still hurts. And we give the 30C again and it doesn't work. And so then we say, well, have you got a 200C? Let's stick with the same remedy. And we ask Carla to give her son the 200C. And maybe it does a little bit, or maybe it does nothing. And the reality is that in its healing process, the vital force has moved on. And it is unreasonable for us to expect that whatever is apparent in the beginning or the middle of an acute is going to be the same thing that will be appropriate in the middle or the end of an acute. How many of you guys have seen in the Materia Medica, when you're reading some reference books, it'll talk about the remedy sulfur? At the end of an acute, you give a dose of sulfur to clear things up. Have any of you guys read that or seen that happen? Dot says yes, but I didn't understand why. And at first I was confused. I thought, well, maybe it only comes, maybe you only give sulfur after you gave a remedy that had sulfur follows well. I mean, I just didn't understand. So one of the things that the old homeopaths talked about was that there are specific stages to acute illnesses. The first stage is usually the inflammatory stage. Inflammation is happening. The body has noticed, oh, Houston, we have a problem, and is reacting. So what are the typical things that we see with inflammation? Standard indicators that say, oh, inflammation is happening. Any suggestions, any ideas? What do you see when inflammation is going on? Red, excellent. Another one, redness is a great indicator that inflammation is going on. Heat, swelling, pain, absolutely. Red heat, swelling, pain. So at the beginning, you need remedies that deal with the inflammatory response, where the vital force is riding to the rescue. It says, danger, danger, Will Robinson, something happened here. And so these vital responses, which create inflammation, which are the indicators that your body noticed something was going on. I mean, it would be a really bad thing if you smashed your hand and you didn't get a response, an inflammatory response. That would be bad. That would mean that the vital force didn't care about your hand and was ready for it to just fall off. So we don't want any of that happening, right? So the inflammatory response has certain remedies that are associated with it. All right, once inflammation is going and the body has a chance to get a whole bunch of white blood cells that run in there and they fight any bacteria that's opportunistic and coming in, that's a second stage. And the remedies that are appropriate once the immune system is thoroughly engaged are moving past those that are really strong at the beginning inflammatory stage. Now, there are some remedies that cover all the stages, but I'll bet you guys can guess a couple of remedies that really hit the beginning inflammatory stage. What comes to the top of your mind? What are remedies that we know? Red, hot, swelling, pain, belladonna, aconite, exactly. These are remedies that we know they're in the inflammatory stage. Now, have any of you guys read in Materia Medica, sometimes it'll say, you can give aconite for pretty much any illness, any complaint, any condition within the first 3, 5, 6, 12 hours. And it's likely to help. But if you wait into the next day or the day after that, it's not going to do anything. And why is that? It's because aconite is so strongly associated with this initial inflammatory stage. So then you get this middle stage where the body is dealing with the immune response, where all the white blood cells are in there slugging it out with any bacteria, where the body is trying to repair the tissues, where it's trying to close up the skin, where it's dealing with granulation, where it's trying to clean blood out of the intracellular spaces, because blood is really, really irritating to the tissues. That's why it's always incarcerated in its little blood vessels. So that's this middle stage. And this has other remedies. These are all the remedies that deal really well with white blood cell function. You know, the basic stuff, silica, calc phos, symphytum, you know, a lot of the remedies that are vulneraries, Bellus Perennis, they're all going to be in this middle section. And then we have this stage at the end that's called the consolidative stage. This is where all those white blood cells that rode in there on the cavalry and they're trying to defend you, they died a death on their sword, and now you have pus. Now you have the accumulation of the battle that went on. And these are not the remedies that create this greenish, gunky discharge. They're very different than the beginning stage. So what remedies might you think of for pus, for greenish, gunky, yellowish discharges? It could be gunky, snotty stuff, drippy stuff from a little kiddo's nose. It could be drainage around a tooth. It could be that the place where you got a cut is now kind of oozing something yellowy. I know, this is such a lovely conversation. Guys, I had a funny situation where I was sitting in the airport and I was waiting for my flight, and I had a call with a client with something extremely urgent. And I'm sitting there at this little table with my little snack and my little drink, and there's another table right next to me. And I'm having the conversation with another practitioner about a case that is kind of panicking. And I'm asking, is there gangrene? What's the odor from the wound? And are you having this kind of discharge or that kind of discharge? Well, so we're in late stage. This person could die. And I realize that we're, discussing uncontrolled bowel function and all kinds of stuff. And I'm sitting there in a cafe. And I glance over, and the woman at the table next to me has a fork full of food halfway to her mouth as I'm talking about the odors of gangrene and how you recognize that. And she's just kind of looking at me. And I cover up the microphone, and I said, I am so sorry. I will take my food outside. And she said, no, don't worry about it. My husband and I just said that we were going to pretend that we were in a zombie movie and that it's all good. So they sat there and ate the rest of their food pretending that I was part of a zombie movie. So there you go, entertainment for the day. Okay, so Carol says greenish, yellowish discharge. We're looking at things like pulsatilla. Oh, good. Calc sulf, kali sulf, excellent. Heparin sulf. So now, does this give you an idea why someone might say, oh, and at the end of the case, you give a dose of sulfur? It's because sulfur is really good at cleaning up the end results of that consolidative phase of illness. So this is why we figure out a perfectly good remedy at the beginning, but it might not be the remedy the vital force needs at the end. And so it should not make us feel like, oh, I didn't get it right, when the person gets partway into it and all of a sudden they need a different remedy. Okay? Does all this make sense for you guys? This might be why you need a dose of sulfur at the end. This might be why the inflammatory remedy at the beginning will only get you so far. And then the symptoms change and you've got to move with it. And yet there are some remedies that are big polycrests. They're remedies with very broad action that will take you through the whole thing. Bryonia applies to every single stage of those. Pulsatilla applies to every single stage. Bobby says, what about when you're told to keep going with a remedy until there's no response? Yes. So the standard rule of thumb is that you give a remedy. Let's say that we gave Bryonia to Carla's son and there was a response and this boy was better. The pain went away. He felt better. He was doing better. Maybe if it started to return, the bryonia was repeated. He felt better. He goes to sleep at the end of the day. He gets up the next morning. Ouch, it hurts. Takes bryonia. It doesn't help. So this is the example of keeping on going with the remedy until there's no response. So then maybe the mom says, oh, well, I'm a resourceful person. I've talked about this in my study group. I know what's going on here. I'm going to put this dry pellet into a bottle of water, and I'm going to do what Robin Murphy teaches, and I'm going to shake the snot out of it, and I'm going to give him a dose in water now and see if moving from the dry dose that he's already had to a liquid dose that has been very thoroughly agitated helps. And sometimes then the bryonia works again. And all that was needed was a little potency change. But maybe you give the bryonia and the kid's looking at you going, yeah, still hurts, not changing. And so this is how you're keeping on going until there's no response. And then maybe you have a 200C. And so you give a dose of 200C, and maybe that's right back on track and the pain's completely gone, and then it doesn't come back. Maybe it's done at that point, but maybe not. Maybe you take the 200C and it has no action because you've moved into a different stage. So when you see the remedy not acting, you could be in a need for a potency change or a dosing change, like putting it in water. Or you could actually need a different remedy. And so this is where you have to go back, and this is why it's so important to write down what were our reasons why we gave bryonia, worse from motion, the etiology of what was going on with the mouth. So we were looking very clearly at the nature of that specific instance. And so if you write it down, you can go back and say, well, the etiology is the same. Is he still worse from motion? If not, then bryonia is probably not indicated. The bryonia resolved that symptom so that it's not needed now. So let's go back and listen to Carla now and see what else she has to say. We've got one more minute of her next stage of her son's illness. So, got your pen? Got your paper? You ready? Here we go.
Yes, I'm calling about my son again. He's the one that had his wisdom teeth out. I talked to you a few days ago. Right, he's doing much better. The swelling has gone down, but he seems to have a different problem now. Where the stitches are in his mouth, where the actual stitches are, he says he's having quite a bit of pain there. And he says what it feels like is that the stitches are really cold. That when he actually breathes in, it's so cold where those stitches are that it makes a shooting pain go up where the teeth were, into the gum area where the teeth were, actually into his head. He feels like there's a shooting pain. So I was wondering if I should keep giving him what you prescribed, or if you want to try something else again.
Okay, so is this the same case? Are these the same symptoms? Should we be surprised at all that bryonia would not be fixing this? Now, we also have to ask ourselves, was the bryonia incorrect, or else it would have prevented this? We can't say that, because it may be that he was too vigorous with his rinsing. You've got to be super, super careful after an extraction to let that blood clot sit in that socket as it begins to heal, to protect all those nerves. And if he was too vigorous in doing a saltwater swish and rinse, he can knock that loose or knock it out in a way that opens that tissue up and that nerve tissue into what's called a dry socket. And these are typical symptoms of a dry socket. So what did we hear? This is not something that I believe we could have prevented with good quality bryonia dosing. This is something that can be part of a mechanical sequela of a tooth removal. Okay, so what did we hear now? What are the specific symptoms that her son has now? Give me three. What's our three-legged stool now? He's got pain in the stitches, and the stitches feel cold, which honestly, guys, that's kind of weird and certainly individualizing. And when he inhales, the pain is shooting into his mouth. Excellent. Pain where the stitches were, cold when he breathes in, and the pain goes to where his teeth were, into his brain, into his head. So, ouch, ouch, ouch. So, what are we going to look at here? Where are we going to find this? What section are we going to be looking at? In the teeth and mouth sections? Absolutely. And we're going to want to find something. If you open up your repertory and you're looking there, we're going to want to find something that says he's worse from a cold breath, right? He's got a cold sensation, pain on inspiration. Yes. And what would we use for the fact that his mouth feels cold in general? The stitches, the area there feels cold. We could look at, yep, teeth, pain, air, cold, pain sensitive, generalities. Yep, what section are you in, Valerie? We've got mouth coldness and teeth coldness. And how do we, yeah, teeth pain from cold air is a really good choice that Kristen brought up. And this would be a great thing where you could ask her, you know, if you were talking with her, is he also, you know, how's cold water? Does cold water make it better? Does cold water make it worse? Teeth pain sensitive to air? Ooh, I like that. Yep, yep, yep. Oh, teeth stitching air when drawing in. Ooh, that's really good. Yeah, 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 yeah. Okay. Is there anything else? If you think about what we're trying to find here, are there any, well, it's not really his It's the roots of his tooth. But his tooth isn't there anymore. But it's in the tooth socket. So Kristen says, not really in his teeth. We could look up in his jaw. Can you find that? In actual fact, teeth is going to be close enough here. Tooth pain extending upward. Yep. Absolutely. That could do it. Okay. So we also have ideas about remedies that have a sensation of coldness and that have an affinity for extraction. Remember, we also have our etiology that's still here, right? What might we want to use there? Teeth pain, general extraction after. Generalities, injuries, that's excellent. So what do we know about remedies that get a sensation of coldness? What remedies would we expect to see there? It's when the vital force has withdrawn its energy, huh? Any remedies come to mind there? Agaricus. Oh, I like that. That actually is a good idea. So what Kristen has identified is something that has a neurological affinity and also has shooting pain and also has coldness of a body part. So yes, I think agaricus is a good choice. Anybody got another guess? Carbo-veg? Yes, Valerie. Things where there's coldness experienced, and where there's an injury. What else? This is very often actually taught as a specific for tooth extractions. Lead 'em. Yes, indeed, Dot. Good job for all of you guys. We should see that in all of these. So let's see. Let me show you a repertorization. I don't know if I got all of you guys' suggestions, but I got a lot of them here. Okay. So mouth coldness sensation, teeth coldness, teeth general cold air aggravates. And, you know, we're pretty sure that whatever we're looking at, we need to have it be dealing with cold air aggravates. And this is the generalities injury. Now, if we want to be more specific, we can move from this information about the tooth. We don't quite have a complete specific set yet, because I haven't included in here yet the shooting that happens specifically with the inhaling. So we're at time now. Let's keep this going. And I'm going to keep this rubric set for us to work with and to continue to refine. And next time, we're going to refine it more. We're going to find rubrics, and this is your homework between now and next time. We'll review what Carla has to say next time, and we'll go through and find rubrics that have to do with shooting pain that's worse from inhaling. Do we find this in face or head or mouth, or where are we going to find something with the jaw, with the teeth? And let's refine and see what other things are most likely to be associated. And we know from our keynote recognition that things like agaricus and carboveg and ledum could be very well indicated here. But we see sulfuric acid here. We see aconite here. We see, could it be causticum? Could it be, what could it be? And I think we don't quite know yet. We're not ready to decide yet because our rubric set doesn't pass our 3 questions yet. Is it true? Is it helpful? And is there anything else that's needed? And so we're not done yet. Okay, guys? Questions? Good job with the recognitions today and with finding rubrics. Well done. All right, so we will continue this next time, and we'll dive a little bit more and we'll refine our rubric set and see what comes up. And then we'll talk a little bit about, okay, once you've got a good rubric set and all these various things come up, what do you do? Okay? All right, guys, have a fabulous week, and I'll talk to you next time. Bye-bye.